we're going to explore lab data and clinical cases. So this is going to be a continuation from both arterial blood gases and renal anatomy and physiology. So we're going to talk about water compartments, serum electrolytes, renal chemistry, enzymes. We'll go through a review of arterial blood gases, and then we'll look at a variety of cases. So when we talk about the body's water fluid compartments, we're talking about both the intracellular fluid compartment, and it makes up about 2/3 of our body's total water compartment, and that is inside the cells, the tissues, and the organs. The extracellular fluid makes up the other 1/3 of the total body compartment. That is your interstitial spaces, your blood plasma, and your cerebrospinal fluid. So the osmolarity is the amount of solute in a solution. And when we have an isotonic sample, that's a 0.9% of sodium chloride. A hypertonic solution would be greater than 0.9%, and a hypotonic solution would be less than 0.9%. Hypertonic solutions can help draw water out of the tissue spaces and go into the intracellular fluid where it can be transported out of the body. And a hypotonic solution can just help maintain fluid status through the body. Also clinically relevant is we can nebulize a hypertonic solution. Anywhere between 3 and 10% is clinically effective. And this is to both mobilize those secretions as well as it's very irritating, so you can get a sputum sample from that. When we have fluid balance losses, our body will have a stimulation of being thirsty. We will have a low urine output, and our patient will exhibit a thready pulse, which means like a weak pulse, a low blood pressure, and can have a low skin turgor. So when you pinch the skin, it won't go back to where it's supposed to. Excess water can show pedal edema, weight gain, dyspnea, orthopnea, jugular venous distension, crackles on auscultation, and ascites, which is an inflammation of the abdominal cavity. Serum electrolytes are chemical compounds dissolved in the body fluid that disassociates into small electrically charged particles, such as positive ions called cations and negatively charged ions called anions. The body's cations and anions are measured in milliequivalents per liter or millimoles per liter, and they help create and maintain the osmolarity necessary to maintain homeostasis. In the extracellular fluid compartments, which is where we measure electrolytes and arterial blood gases, we can see that sodium is our main cation, and chloride and bicarbonate are our main anions. Other electrolytes are calcium, total carbon dioxide, which is the same thing as bicarbonate, because if you remember, bicarbonate carries our carbon dioxide levels from the tissues to the lungs to get exhaled out. Chloride then is our negative charged anion. That, as well as magnesium, helps maintain our action potentials in our body. They also help to a small degree with the buffering systems of the pH in our blood. Sodium regulation is what our kidneys also work on, and it really helps maintain the osmolarity in our fluid status. So when water leaks into the tissue space out of the intracellular space, it will decrease the overall circulating blood volume. Therefore, that will decrease your blood pressure. In response to that, your body will then increase your antidiuretic hormone. It will hold water in. It'll increase aldosterone, which also leads to a reabsorption of sodium and water. And therefore, as a net outcome, your body will increase its sodium reabsorption and your potassium secretion into the urine. Decreased potassium and sodium must exchange instead with hydrogen ions then. And if your hydrogen ions then are out of the extracellular fluid compartment into the intracellular, that will result in a metabolic alkalosis. The normal potassium level in the extracellular fluid is about 3.5 to 5.5 milliequivalents per liter. It helps to maintain electrical membrane potential for both neuromuscular and cardiac electrical activities. It's the major intracellular cation where the concentration is about 160 milliequivalents per liter. Another very effective clinical lab report that respiratory therapists should pay attention to is the lactate level. So the lactate shows the severity of shock in a patient's body, which is a profound hypoperfusion, and that will lead to anaerobic metabolism. So if you think about anaerobic metabolism, once that glycolysis breaks down, it should go, when there's enough oxygen in the environment, from pyruvate into oxidative phosphorylation, or the electron transport chain. When it doesn't have that oxygen, rather than pyruvate, it gets converted to lactic acid. So if that builds up in our bodies, we know that tissue perfusion is inadequate, or oxygen delivery is decreased, or oxygen uptake by the cells is significantly increased compared to that delivery. Therefore, we can have ischemic cells, which is when cells do not get enough oxygen for an extended period of time. They die and become ineffective. And this is very commonly accompanied by a metabolic acidosis. So, renal chemistry. An enzyme that will trigger the hormone aldosterone is called renin. So the renin-angiotensin mechanism is released to stimulate the kidneys to release that aldosterone, and therefore, as a result of aldosterone, they will reabsorb sodium and water, which will have a final outcome of increased blood pressure. So here we go. If our blood pressure falls, the perfusion to the kidneys will fall. Renin, the enzyme, will be released, and it will have angiotensin 1 convert to 2, convert to 3, with a net product of vasoconstriction and the release of aldosterone. And when that aldosterone gets released, sodium and water will be reabsorbed. That, along with vasoconstriction, will increase our blood pressure back to the normal range. So if we look at the ACE inhibitor or cardiac medication called captopril, what it does is it inhibits the function of angiotensin converting enzyme. So therefore, vasoconstriction will not happen and aldosterone will not be released. So therefore, sodium and water absorption will not take place, and that will help lower blood pressure. Antidiuretic hormone regulates the electrolyte concentration and osmotic pressure in the body. It regulates the water and sodium reabsorption, and factors that affect antidiuretic hormone release would be alcohol consumption, would inhibit ADH, meaning it would encourage your body to urinate. Injury to the hypothalamus or diabetes insipidus will both have a dysfunction in producing antidiuretic hormone, so therefore your patient would retain fluid. And then also in SIADH, which is syndrome of inappropriate antidiuretic hormone, there will not be as much diuresis, and therefore your patient will become fluid overloaded. Your patient would then need to be placed on a strict water limitation. This is clinically seen frequently in patients with lung cancer. Blood urea nitrogen, or the BUN level in the body, is a lab value that you can get from a CBC, complete blood count, and the value should be 7 to 21. Your creatinine level is much lower at 0.7 to 1.4 milligrams per deciliter. The BUN is the most common test to assess for renal function, as the kidneys are responsible for clearing out that nitrogenous waste that is produced in the liver. And therefore, if that is building up into the kidneys, you know that your kidneys are not doing the job effectively. Creatinine is formed within the muscle tissue, and it can be elevated in late-stage kidney disease because it will be elevated with an increase in muscle breakdown. So once again, this isn't a great lab value to assess kidney function because it happens in later stages. Enzymes are chemical compounds that speed up any physiologic process in the body. They can be measured to assess how the different organs are working or to assess if there is damage that's taken place in the organs. So take, for example, cardiac and liver enzymes are very common. If you have an enzyme, a cardiac enzyme that is increased, then that's a good indicator that perhaps the patient has had a myocardial infarction. If the ALT and AST liver enzyme are increased, that could tell you that the liver is having some dysfunction, and so you're needing more enzymes to help break down those processes that take place in the liver. And then another common one is CRP, or your C-reactive protein, and this just detects acute inflammation due to infection anywhere throughout the body.